Nafanya kazi ya gold mine kama fundi kujenga shimo. Ndio sasa nilikuta sasa hata sifanyi kazi hiyo. Nikakuta niko na ugonjwa niko nasikia kifua inauma sana.
These are stories of Kenyans who have had encounters with TB. Stories of pain, confusion, and despair at ailing from a disease they did not understand. But there are also stories of relief, clarity, and hope.
There is a missing link. There is a lot of issue in detecting the requisite numbers. For example, in Kenya, we are supposed to get about 140,000 TB cases to be detected annually, but our systems are only able to detect 72,000. That's just slightly over 50%.
The war against TB has interested various governments, organizations, groups, and individuals. At the forefront of this fight is the Global Fund to fight AIDS, TB, and malaria. The international mechanism mobilizes and invests money in partnership with governments, civil societies, private sector, technical agencies, and people affected by the disease for efficiency towards prevention and care. It invests $4 billion a year to defeat these diseases and ensure a healthier, safer, equitable future for all. To de-escalate the calamitous situation in Kenya, the Global Fund partnered with the Ministry of Health and Amref Health Africa in Kenya to work towards eradicating TB and malaria in the country. Amref received grants from Global Fund through the Global Fund TB project, GFTB, to work with the Division of National Tuberculosis, Leprosy and Lung Disease Program, DNTLDP, local partners and communities to implement interventions that will lead to the elimination of TB in Kenya by 2030.
In this grant, what the country thought was, can we look for better ways of getting these missing cases, and that is where we talk about strategic initiative, dedicated resources to look for new ways of finding these missing cases.
We're working through the community health structures, which is actually level 1 of health service delivery in Kenya. So we're working with the community health volunteers. But Amref, as a non-state principal recipient, implements its activities through civil society organizations. So we engage them as sub-recipients of the Global Fund Grant. And like in the current grant, we are working with a total of 38 sub-recipients and covering all the 47 counties in the country.
Amref Health Africa in Kenya implemented community TB interventions in all 47 counties through 28 sub-recipients, working with healthcare workers and community health volunteers, CHVs, in public, faith-based, and private health facilities that are TB treatment sites. The key interventions implemented were sensitization of CHVs on TB, TB HIV, TB prevention therapy, TPT, contact screening and tracing of patients who interrupt TB treatment, supporting CHVs to conduct household health education and TB screening for household contacts of patients with bacteriologically confirmed TB and children under 5 years of age with any form of TB, supporting healthcare workers and CHVs to trace patients who interrupt TB treatment. Other community interventions were targeted TB screening outreaches using mobile X-ray machines and GeneXpert.
My name is Timpia Liseni. I'm a former TB patient. I started an organization that is called Talaku. The meaning of Talaku is set them free. Set them free from what? From TB. And we started working with Amref, that is Global Fund through Amref. And through this, I can say it has helped Talaku to grow. At one point, we were just focusing on Kajiado Central. But because of working with Amref, we are now covering the whole of Kajiado County. We've also seen men now coming to hospital on their own when they get sick. We've also seen men allowing their women to come to seek health services.
The targeted outreaches were conducted in various TB hotspots across 12 counties. County Tuberculosis and Leprosy Coordinators, CTLCs, aided in identifying the hotspots, coordinating and offering technical support during the activities.
There has been reduction in the disease burden in the community. For example, upon the realization that someone has TB, they've been able to go to the facility based on the information they get from the community health volunteers.
Amref Health Africa in Kenya, in collaboration with the Division of National Tuberculosis Program, implemented the Kenya Innovation Challenge TB Fund, KICK TB, as part of efforts to find the missing people with TB in the country. The purpose of the $2 million competitive funding within the 2018-2021 Global Fund TB Grant was to identify, pilot, and scale up implementation of innovative context-specific interventions aimed at actively finding and treating missing people with TB in high-risk communities.
The Innovation Challenge Fund was to help communities come up with ideas in terms of how we then target specific populations that were identified from the prevalence survey as having high TB burden or as special to the TB program.
Ilikuwa ngumu because hujui ni alsa, hujui ni nini. Mwili yangu haikuwa sawa. Yaani siwezi fanya, hata kusimama siwezi simama. Alafu nakohoa na meza dawa. Nilimeza dawa hata hii ya Wajaluo hii. Nilijaribu. Hii kienyeji hii. Nilimeza hakuna. CHV wangu alikuja huku mashinani huku kutuambia kuhusu hii nini screening ya TB. Waliniambia niende Makongeni dispensary. Wakapima hiyo nini kikozi. Walipata kama niko TB positive.
To date, the key populations who have been reached in various areas include students, prisoners, healthcare workers, people living in informal settlements, people operating in marketplaces, and public transport termini.
We targeted this population to make them feel like they belong, to bridge the gap between the health facility and them, to make them understand that these health services are for them.
Vile daktari alinipima, akanipigia simu nikiwa Malaba, njoo upate result yako umepatikana na TB. Sikuogopa, nikaja nikaipata, niko na TB.
The 9 KICK TB sub-recipients worked with the National TB Program, Amref Health Africa in Kenya, county governments, and other stakeholders to develop and implement their innovative interventions to mobilize and link targeted high-risk populations for TB to timely TB diagnosis and treatment.
So our innovation is about using an automated TB screening machine. It comes loaded with questions about TB, the basic questions that we ask when you have TB. Any person who comes is able to self-screen. So you don't need a healthcare worker, you don't need to go to the facility. And once you screen yourself, we also present to you an opportunity to collect the sample, take it to the facility, test it for free. Then we're able to reach back to you, come get your sample, we cancel you. And if you have TB, we link you to facilities that will leave the government health system. And this is all free.
kama singepata community health frontier aniongereze, nipimwe, nifanyiwe thorough screening, saa hii singekuwa najua chochote kuhusu afya yangu, kuhusu matibabu ya tuberculosis. Ningekuwa afya yangu inatofika pole pole bila kujua.
Through the Kenya TB Innovation Challenge innovations, 427,780 people were screened for TB, out of whom 1,744 were diagnosed with TB and put on treatment.
Mimi nilikuwa tunafikiria ni kikozi normal tu. Most of my guys, especially wenye tunafanya nao kwa jua kali sector, au kwa wananitaka juu saa zingine nikianza kukohoa nasikia we songa na uko mbali wewe utatuambukiza. Hiyo ni challenge, ilikuwa ni challenge kubwa sana kwangu.
Amref Health Africa in Kenya, in partnership with the National TB Program and Population Services Kenya, PS Kenya, implemented public-private mix, PPM, interventions to enhance the contribution of unengaged formal and informal health providers in finding missing people with TB.
Nikaamua sasa kwenda kwa mwenye chemistry, nikamuulizia.
Health facilities in the private sector contribute significantly to the missing people with TB, since 42% of patients with TB symptoms seek care first from private providers.
We normally have a screening book whereby we normally question the clients, whoever comes here, we ask them the questions. How long do they cough? If they have chest pain, night sweats. Those are the questions that we normally get presumptive cases. When we get presumptive cases, we normally give out the bottle to go and bring the sputum for testing.
So again, here we were engaging private providers who've never been engaged in TB before. And this would include clinics, chemists, and we came up with an idea in terms of identifying which facilities this who met a particular criteria that we could then engage to screen the patients who get to their places and then refer them for further investigations, either at private facilities with lab or the government facilities.
Key interventions included mapping and engagement of private health providers in TB service delivery, capacity building of private providers through sensitization and training using the National Integrated TB Curriculum, strengthening recording through the development and customization of reporting tools for the private providers, strengthening sample networking to increase access to diagnosis, joint support supervision by sub-recipient staff, county and sub-county teams to support the providers to provide quality TB screening and testing services, incentivization of the private health providers based on the number of people tested and diagnosed with TB.
We have benefited because, first of all, it has marketed our facility. When the client comes, they find out that we can provide them more services apart from giving them medication. We still can refer them on TB cases and they can get medication. They go out calling other patients to come from our facility for service. So it has really marketed us. Their sales have really improved.
Through the public-private mix interventions, 427,039 people were screened for TB. Out of these, 1,140 were found to have TB and initiated into treatment.
Nilipigia after 3 days, nikaenda kuchukua result, nikapata results ziko positive. And wakaniuliza health center niko karibu na mimi. I told them, wakanipatia certain referral letter. Nikaenda nayo huko. Sasa huko ndio nimekuwa nikichukua madawa. Nilinipatia madawa for 6 months. I took all of them, nikamalizana nazo. Ambapo saa hizi I'm now doing good.
Amref Health Africa in Kenya worked with the National TB Program and other partners to improve drug-resistant TB case detection and link patients to treatment.
Safari yangu ya MDR-TB ilikuwa chungu, Sababu unajua hapo sasa ni dawa na mazidano. Venye niendelea kundungwa ile zidano na kutumia zile mandawa, mwili wangu ikaanza tena kuregain tena.
Each county identified one MDR champion. This is a patient who has had multiple drug-resistant TB in the past, has been treated and is now cured, and they have volunteered to talk to other patients. So we had about 24 counties and 24 champions whom we sensitized.
The key activities implemented were prevention of MDR-TB through building the capacity of healthcare workers on infection prevention and control, providing social support to DR-TB patients on treatment through a monthly stipend of 6,000 shillings for nutritional support and to alleviate financial hardship. Supporting community MDR-TB care delivery by providing a monthly stipend to healthcare workers offering directly observed therapy services to DR-TB patients in the community. Engaging all care providers by building private sector capacity in TB, including MDR-TB control. Supporting former DR-TB patients to conduct TB health education to TB and DR-TB patients at health facilities and carry out TB awareness and advocacy in the community.
Every month, we supported these MDR-TB champions to go to health facilities and offer health education, work with the other patients, talk to them about adherence and about their experience with MDR-TB medication.
Resilient and sustainable systems for health, RSSH, are essential to ending HIV, TB, and malaria epidemics. The activities we implemented under RSSH include community systems strengthening pilot in Kwale, Vihiga, and Homa Bay counties, implementation and use of iMonitor alert systems to strengthen community-based monitoring and social accountability, building civil society organizations' capacity through organizational development and systems strengthening, ODSS, building the capacity of CSOs and community champions to participate in county development processes and in advocacy of domestic resource mobilization, integrated sample referrals and service delivery for quality improvement, health management information systems, HMIS, and monitoring and evaluation.
Usually the TB program has meetings where the TB coordinators throughout the country meet, and they're actually assessing the progress in terms of the number of cases they're having, how far the people who've defaulted TB treatment are being able to be identified and brought back. And the information we are getting is like the progress is really having impact in terms of bringing back the people.
Global Fund na Amref wametusaidia sana kwa sababu at least the program create awareness.
I'm very grateful personally, and the Meru County at large, including my seniors, are very grateful for the milestone that we've been able to show.
In fact, we are where we are because of them.
They actually made this innovation possible. Without them, this innovation would not have been possible.
I would really take this opportunity to appreciate them, and I wish that we continue working together towards ending TB in Kenya by the year 2035.